the network? Well, we, as I said, count on different organizations which are part of our network. So in that sense, we have acted in two stages. First one was immediate, to save lives and to survive. So we have trying to direct and to manage this crisis, which has left a lot of women without work. As we know, in Spain, the care system is a system which counts on many migrant women who have, unfortunately, for a long time been in an illegal situation. So after this crisis, a lot of those women were left jobless, and all that they had in 2 weeks time was over, and they found themselves in very difficult situations with children that they needed to support and they couldn't, with children that needed to go to school but couldn't. So they could not even ensure the basic necessities like food and clothes for their children. COVID has also uh, increased the gender-based violence and crisis, as we heard from our colleague, was to trying to just put out the imminent fire that was caused by COVID. So afterwards, in June, between these most affected and impacted groups, such as migrants, we've seen a very worrisome reality, and which was fundamental for our network and was to start with the activities. Now, we have seen, for example, long lines to buy food. We have seen women, migrants who had no access to public services, for example, in the community of Madrid, because they, as I said, were in an illegal, irregular state, civil state and situation, and could not, were banned access from such institutions. Now, different institutions from our network and employees working for them have put themselves in danger because they had to distribute food to these vulnerable groups. But still, nonetheless, despite the risk, that voluntary work was fundamental in order to maintain and to their lives. So we had meetings almost every week where we were sharing experiences, making each other feel better and trying to support each other. Another stage of our work as a network was the advocacy work for people who have found themselves in extremely difficult situations, so they could use, and you can see in our blog what the communication we issued with some specific proposals in regards to COVID. In addition to that, we have written an official letter to the government in terms of regulating the status and aiding the most vulnerable groups. Now, I will not focus a lot on that legal aspects. I will leave that to my colleague who will speak tomorrow, but I do feel the need to emphasize the importance of it. Now, when I was speaking of the conflict between capital, so money and life, and especially vulnerable situation of migrant women who within the COVID crisis have seen their situation deteriorate even more so. The measures taken by the government, for example, the measure of aiding people who have temporarily could not work, not lost their jobs per se, but simply because of nature to their job could not work. These women do not have a right to that kind of aid by the government. So for them, on our behalf, we had to involve a lot of our activities into advocacy on their behalf in order to force and pressure the government to make an amendment as an exceptional amendment to pay some sort of fee and assistance, at least for a couple of months, to those women. Additional measure which was very relevant and which we were trying to distribute at the beginning of COVID was basic rent. That basic rent, the progressive government first initiated at the beginning, but it unfortunately doesn't, once again, is not accessible to the majority of migrants. And we have around 80,000 persons in an irregular state. So if we have that many persons who do not have a legal regular status, they will not have access to this basic rent. So that includes a lot of workers at homes who work in home care, who being in an irregular situation and having lost temporarily their opportunity to work, they don't have access to these measures. So many of them did not have access to all these alleviating measures provided by the government, which is why advocacy was very important. There were many measures which didn't reach, for example, also migrant men who are now shamefully for the government sleeping on the streets and women on the streets. So this is all happening now also in places of big warehouses where they used to work, and now they use it as sort of temporary shelter, which is really a sad image, having people with this pandemic, which is very dangerous, living in such unhygienic conditions. So I could really speak about this for a very long time, but I understand that there is a time limit for my presentation. So in this conflict between money and life, I see that we are not all being treated equally, and many are left behind. As I mentioned at the beginning, COVID has placed a focus on national and I believe also on international level, the care for life and life sustainability. I understand that some public resources and services were not available to any or to all people, and not just that, public health was also overburdened, that's for sure, but health personnel did help to some extent. They did try to include migrant women into their ranks, women who were cleaning, also women who were working in stores, and women who were working in the field were suddenly left without any funds, and we did not feel that their contribution was recognized enough. And that has to do with the general lack of consideration and recognition of their work and their contributions. They're invisible for the majority of population, and that additionally feeds more and more stereotypes, because we can hear more and more each day that all the measures implemented by the government before the crisis and now during the crisis, the typical commentary is, I'm not racist, but there is always a but. and not to mention the very discriminatory names they give to people of different color, different nationality, or religion. So this is very worrisome. And now in Spain, before the COVID, we have seen the right-wing um, currents being more and more strong, but now with COVID, we have witnessed it even more. We have witnessed it within the institutions, and it's really sad to see these images when you see in the asylum centers minors, unaccompanied minors who are alone without their parents. And in addition to that, we see the gender violence being very much emphasized. So for us, for all the organizations who form part of our network, who are fighting for the rights of migrants, of migrant women and children, we are trying to show and to construct actually a new narrative on a level of community in order to face all this hate increase which we are witnessing. You can see on the blog of our network many of these things, but I can just comment them briefly. We are insisting urgent regulatory frame to be implemented when we're speaking of home care workers, better access to basic rent for them, for it to reach a larger number of migrants for on a general level without having to specifically ask for it to have a permanent residence for all the migrants. So it's already very difficult for Spanish women to keep their jobs and to do their jobs. And then can you imagine how complicated it is for migrant women? They have additional complications. And in addition to that, when we include the threat of gender violence, government has invested some efforts, but they're always limited. So we are keep insisting on distributing information to migrants, to amplifying the access to different services to migrants in general, and especially migrant women. And to finish, I would like to share my thoughts, which can afterwards serve as a basis for our debate. Um, how can the associations who have been working and trying to work on resisting increased abuse and precariousness, how can we increase our community work and community activities where actually lies the strength to be able to face these threats? For example, in Spain, we have seen in 2008 a very strong and difficult economic crisis, and afterwards, we have done a study in 2014 of its impacts. And now this crisis is even more serious. So now we are currently elaborating a document about incidents about impact on migrant women, with specific recommendations on how to reconstruct the country, where we should give our contributions and make our voices be heard. And hopefully next month we will finish it and be able to present it in September. So this year our network is celebrating the 10-year anniversary of existence and activities. So in that sense, we are participating with the different organization of women organization, migrant organization, and we're trying to increase our influence to make our voices heard and to give specific recommendations about reconstruction, both economical and sustainable in general, So that for me was my conclusion. So here I leave you, and thank you very much for all your attention.
Advise you to mute also the original audio so you can hear only the translation. Now, I want to introduce Kimi Oluwakemi Oyewole. I hope that the pronunciation is more or less right. Sorry for my accent. Kimi is an activist, advocate, and public speaker promoting women's rights globally. Nigerian by origin, Kimi is actively engaged in building capacities of professionals within institutions and CSOs in Serbia on gender-based violence, gender equality, and migration, as well as anti-discrimination standards and policies. She is actively involved in supporting migrant girls and women, especially those suffering different forms of violence. She will be speaking on behalf of the advocacy group of young women supported by NGO Atina, a feminist organization with the aim to support independence, empowerment, and full social inclusion of women and girls. Kimi, good afternoon, and thank you very much for being here with us.
Good afternoon. Thank you for having me here. Hi, everyone. My name is Kimi. I'm from Nigeria. I've been in Serbia for more than 2 years, and I'm here to address some challenges that women refugees are facing, most especially during this period of COVID-19. However, I would like to start with the information upon arrival. From my own personal experience, when I first got to Serbia, I never knew I was in Serbia because my intention wasn't coming here. I was going to another country, but circumstances brought me here. And upon coming here, I did not get the needed information on time. There is absolute lack of information when you first arrive to the camp. I mean, it takes weeks before getting the basic information from the right authority. And on the other hand, married women get information through their husband. The information is being passed to their husband, and they act and rely upon what their husband informed them. So automatically, they do not get the information by themselves. They have to rely and act upon the information. Whatever their husband told them, they have to do it because they think maybe it is true, whether it is true or not true. They have to act upon it. There are specialized organizations which are targeting women, but they are not present 24/7 in the camp. So it takes time to get to meet them. So, but when you get to meet them eventually, then they get to engage in workshops and to assure you that, okay, fine, you are not alone. And you will all agree with me that traveling alone as a woman is really risky. It is like a game between life and death because you don't know what might happen to you during your journey. But you have to embark on the journey to save your life. So when you now get to where you think there is more security, more safety, and they don't get you informed on time, do you know how the person will feel? Of course, unhappy. And to make matter worse, Corona came knocking and isolation gets started, still with zero information. The only thing we keep hearing is stay at home and wash your hands. Stay at home without sufficient information and sufficient provisions. Staying home in this time of COVID-19 increases the rate of domestic violence. And talking on behalf of married women, how do they get help when violence strikes him? It is unknown to them. When you live in a camp, you seem to be more safe, more secured. And if there is violence, security and camp staff will react. At least somebody will call the police. And if you are sick, some organization will come to take you to the hospital. But then during this time of quarantine, there was no organization present in the camp except the minimum, the smaller number of commissariat staff, and with thousands of refugees. So there is no way they could manage the situation with them. Integration is another challenge. When staying in the camp, we all attended to by help. We don't get to speak for ourselves. They help us to translate, to talk to people, to get the help from people, you understand? So the organization speak on our behalf. So, for example, when the time comes for you to leave the camp, you get some financial aid from the state, but without the right information on how the system functions. And you have to find a place to stay all by yourself. That is very challenging, because I remember when I was searching for my own apartment, the stigma we face as refugees is really on high rate. Many people do not want to rent us an apartment. After almost a year of searching for an apartment, I finally found one in the building where only refugee lives. And even remember there was a time I went to that area when I was trying to park. So I went there, then I lost my way. Then I asked, I was trying to go back, like maybe I didn't know that. But someone was like, oh no, I know where you are going to. That is the apartment. So definitely they know that this apartment is meant for so people. Because I don't know them. They don't know me. They just saw me that I'm Black. I'm probably a migrant or refugee. And they said, this is your apartment. And I was like, oh, thank you. I was wondering, how do they get to know? So that apartment is mostly for those people which are refugees. So to leave the camp or to change the apartment, you need the permission from the asylum office, which takes at least 2 weeks. So imagine being a woman living alone with a violent husband on a private address in the time of Corona. Who will fight for you? How do you get help? Or how do you get help and stop suffering in silence from the husband? So how do they get in touch with the police? And if they eventually get in touch with the police, and maybe they call the police, will the police come to their rescue? How do they want to leave the apartments without without taking that 2 weeks before the asylum office take actions? Who will fight for them? Where do they want to go? And during this time of COVID-19, hostel are not working. If the woman gets, maybe she has money to move out, to find something for herself, to stay safe maybe for some period of time, but she cannot just leave the apartment without the permission of asylum office. So all these things has to be known. We need the means of getting informed about the system. The means of getting proper access, and we need resources to cater for ourselves as a refugee. We need information to know what is happening around us from reliable source and not from the rumors, because all what we hear nowadays is rumor. We hear this is happening, this is happening, this is happening. We don't know maybe it's true or not. We act upon rumor that we heard, which affect us. It affects us emotionally. So we need more recognition in the society. Those in medical circle they are another thing entirely. They need to know and be informed about the right of refugee. Because as a refugee, you can't just hold your card and walk into the clinic and say, okay, I need the medical attention. You have to go with a recognized organization before they will attend to you. Because we don't have the medical insurance. And that reminds me of one Kenya student. He was a foreign student. He had this medical insurance, So during this time of COVID-19, he had problem with his stomach. So he was calling for help. Nobody was willing to help him. So he kept knocking on the door to door, door to door. Maybe he could finally get help, but nobody was willing to help him. He was left alone in a room until he lost his life. So upon hearing this got me really scared, because I believe if this could happen to a student that had medical insurance, then something worse could happen to a refugee woman that have no medical insurance. So that got me stuck in my apartment without even looking outside. So I doubled, because I don't know, as in the fear of what might happen. So I doubled isolated myself. In a situation like this, we need more confidence, and we need serious help in getting recognized by the system. Quarantine was a very scary situation for everybody. So we were all thinking, like, if we feel some symptoms, who do we call? Who do we go to? Organizations that are helping refugees? Okay, fine. If we call them, are they going to come to our rescue? Are they also, everybody is scared of their health. Are they also scared of their health also? Like, oh, I don't want to risk myself. Maybe they will not come. So for that reason, we need correct information to what kind of medical care we have access to. Maybe there are some extents we could go. Okay, fine. Maybe there are some. We have to know the extent of where to go to. We need proper health care card that is the card that is well recognized, that if you go to the hospital all by yourself, you show them, they know who you are and how to attend to you. And at least one English speaking person, because we have mostly problem about the translation, the language in general. We have problem about the language because there are different languages from different women in refugee. So situation for people in camp during this quarantine period was different. There was less cases of violence reported, but fear for the health was big. At that time of COVID quarantine, the camp were closed. No one could get in or come out. So no one could come in or go out. I mean, people were asking, how long will this last? Over 1,000 persons just in one place. They were scared. Even if somebody sneezes, everybody will be scared. It's a problem. You must not sneeze or cough. In some camps, there was a problem in food supply at the beginning. So, and because of this lack of information, they were all got trapped just in a place. Also, let's look into labor markets. The challenges of keeping a job and fear of losing a job can give someone high blood pressure. Getting the job requires a lot of stress because you have to go through one organization. As a refugee, you cannot just walk into a company and say, okay, do you have vacancy? I want to apply for a job. I don't know how I don't know how it is like that, because maybe for the fear of being humiliated, of being looking down on as a refugee, we almost deal with low self-esteem because of the stigma in the society. So during this pandemic, getting food to eat became an issue. Paying rent became a problem. On my own case, people advised me like, okay, tell your landlord. He knew you are not working. He will understand. And of course, you can pay him maybe when you start working. Then I asked myself, how do I want to pay 2 or 3 rents just in a month when I start working again? Because 2 rents, my salary cannot even pay 2 rents at a time. And the landlord was threatening me that, okay, so time you have to leave the apartment. So even so now the constant of losing the job during this pandemic because of the employers were also struggling for their business. So they have to reduce the amount of the people working for them, the amount of employee. So when they were targeting people, of course, I know that in my mind, I know that, okay, the local people will be prioritized because they can't just put me ahead of their own people. That was my thought. But the good thing is I didn't lose my job. They kept me and I was still working with them this day during after the quarantine. So, but the idea without having any job, it's really bothered me all the time. Many refugees started to live on private addresses before the pandemic. They are now left jobless. All of them don't have work now. So they have to rely on financial aid from NUHCR, which also makes them desperate. At the moment, when you start to integrate into the society, like when you think that, okay, now you are becoming independent, you have to build your life to find yourself again. As in life, you are building yourself to find yourself again. And now this happens and you have to depend again on someone. So this is not encouraging. What happened to single women? Will they be more exposed to sexual harassment? We don't know. Will married women be more exposed to violence from their husband if their husband stays at home? Because we all know that nobody was working during that quarantine. So the husband will be at home with their wives. Okay. There are also issues that make you think in a situation of curfew. It was really difficult to women in the situation, and they do not report it. Even providing support was problematic because it was impossible for a woman to find isolated place in the apartment with their husbands present in it. This is the issue that is problematic even for the local society. As we know, the number of reported cases increases on a daily basis, and that should be addressed broadly. So for that reason, the existence of organizations like Atina, it is very important for us, women refugees, so that we can come out of the shadow, of ourselves. We can be able to come out freely and strongly to address relevant institutions in order to influence ourselves, to reflect our own position. So we need to be able to come out and tell our stories to inspire others. Thank you.
Thank you very much. Thank you very much, Kimi. So now I would like to give the floor to Silvia Zúñiga. Silvia is a feminist activist volunteering with the group Feminists for Nicaragua in the Basque Country, Spain. She will Resistance Emergency Fund, I Don't Leave Them Alone, for supporting migrant women who work as domestic workers and are in a vulnerable situation in the context of the pandemic. This has been an effort shared with other 3 women migrant groups in the Basque Country. She will also address the issue of the current situation of Nicaraguan migrant women. Good afternoon, Silvia, and thank you very much for being here with us.
Hello, and thank you very much to all participants who are listening to our presentations. My name is Silvia Zúñiga. I am an activist of Feminists for Nicaragua. It is part of a bigger network. Feminists of Spain are distributed in different territories. My organization specifically is Basque Country, Spain. Feminists for Nicaragua, who are in Bilbao. We are defending the rights of women working in home care because they need our help, and we are a very young, newly formed group 6 months ago or so, and the additional 3 organizations which participate in these activities with us is also the Association of Feminists, Anti-Racists as well, which promotes cooperation of different feministic and women rights defender groups, solidarity between women trying to participate in exchange of cultural experiences. We're also counting on different networks of women organizations who are also formed of indigenous women who most of them work in home care. So they all help us to in our joint efforts to improve the work conditions of all of them. So uh, those women who work not only in home care but also home cleaning services, they need, in addition to different kind of support, advocacy, and as well as legal assistance. So our goal is not to leave them stranded, and it was really supported very much by consultancy agency also, which works in empowering women and fighting against women discrimination. They are always supporting feminist organization, and among them is the Feminists for Nicaragua. On the 30th of March, we have activities which were directed to migrant women who have been suffering because of the impact of COVID-19 in both their professional and personal lives. So we have directed a certain significant number and a quantity of funds for them to aid them, and we have gathered the financial aid in just 1 week after starting, and the call for donation. Now afterwards, we wanted to make the action more global, more the one which could include a large number of beneficiaries. So concluding that process, we have managed to collect more than 60,000 euros for this cause, and the women, uh, which were 136 when it comes to beneficiaries, received some symbolic aid on our behalf, but it was very important for them because it could, for example, cover some basic necessities like the rent. So for them, we understood that those who were working in home care out of a sudden were left without any funds. They had this serious worries about how are they going to get to the end of the month. So that is how we could understand their issue, and then that's why we started this initiative. And that initiative of gathering finance and distributing it to our beneficiaries from, like I said, end of March until today was really there to help women in a very concrete and specific way. Now, our organization during the 3 months of the crisis was trying to aid more than 70 women, not just by distributing that symbolic financial help, but also psychosocial assistance, advocacy, counseling, trying to inform them because we understood the value of information and what social services could they benefit from, what services were accessible to them. So we were recognized by different institutions. We understand that these are women who do not have their legal status very well defined. They don't dispose of social welfare. They don't have access to any social welfare. They don't have access to food donations. They really are out of the system. So in that sense, they depend on themselves only. Uh, in that sense, a small aid just by ensuring that they can pay the rent for a couple of months was very much valued. So it was really vital to give them that power to decide and to take care of their health and not to worry about other issues. So that for us was really a big an important experience. But on the other hand, it made even more evident a reality which we already were aware of, and that is the discrimination and marginalization of certain groups. Not to mention the gender-based violence, which was very much present, even more so than before. So, if women were before exploited and abused with longer working hours and smaller salaries, you can even imagine how much that was taken advantage of during the time of crisis. So, if they didn't do their job, they were threatened by getting fired, so they could be end up in a street from one day to another. It was really in a situation of quite worrisome and of high stress, and that is where we tried to alleviate a little bit that harsh reality that they were living. We have tried to alleviate the consequences of gender-based violence, not just when it comes to couples and married couples and within the household, but also by employers, which was present in several cases that were reported. So obviously, this crisis affected us all on a global level, but we as people who are in economies which are not so strong are really the biggest victims of this epidemics, because if it was difficult to find some side jobs before, now it is even more so. I had 3 different side jobs, temporary jobs at one point, and now with the crisis I don't have any. So what can I live off? Of 30 euros per month income? Of course not. So obviously the answer of the institutions and of the government was not that much focused on people who work at home, who do not have access to different social and medical services like others who have a regular status, legal status. So the measures that the government was speaking about were actually just nice words, polite words, but it didn't affect such a big community, which really can only count on, sadly, on some small organizations, feminist groups, and it was made clear to us that we need to take care of ourselves, that we need to tend of ourselves, because we are marginalized completely and we are not um, on the agenda, on the political agenda or any other where we are recognized, as the basis of economy. We are the basis of economy. We support those households in which we serve, in which we work. No one recognizes our work as something relevant. So in that sense, we don't see any kind of support, not by the institutions, not by the government. We are completely discriminated and marginalized. So no one is even paying attention to such vulnerable group like home care workers and uh, home workers in general. I um, I know firsthand that uh, persons, migrant women who have applied for asylum were rejected. The majority of them was rejected. So it is a very clear response from the government about the extent in which they want to integrate us into the society. So I have in December, for example, my first appointment to regarding this migration status issue. So, and what am I supposed to do until December? So, my only use in point of view of government is to serve in that black economy, which needs people like me, but never to fully integrate me into society on personal or professional way. So our needs are being multiplied every day more. We have seen how institutions, public institutions, are not doing their job, and those jobs are being done by NGOs, organizations, communities, women who have organize themselves in order to aid each other. So, but public institutions are really renouncing responsibility. We need to then continue to organize ourselves, because if this doesn't change and the crisis will go on, we need to be able to answer to the consequences of the crisis. So I believe that this is important to emphasize the reality which we live in, and to just increase our visibility, to make sure that they see us, that we're present, that we're part of reality which most people don't want to talk about. So we need to resist precariousness, racism, which we're experiencing, because it's amazing that in these days and time, me walking on the street, before I couldn't even walk on the street because I didn't have any working permit or a permit to move. So who would give me a permit to move around during the COVID crisis and during isolation and quarantine? No one, of course, because they don't have a legal status in the country. So institutional answer has failed completely when it comes to uh, focusing on our situation, and we need to cater for ourselves. So they say that Central American migration is being increased very much. Even here, just in the Basque Country, we can see how many women and men come from that region, from the Central American region here to Spain, where we are very much exploited as women in working conditions. We're abused. So we need really to make sure that these public policies, which are mentioned as pretty words, are actually viable, sustainable policies that contribute to specific actions. We need to, as a migrant population, we need to pay everything much more than the regular population, and we always earn less. So our organization, Feminists for Nicaragua, and other joint organization, um, we have initiated activities in order to implement our issues into these public policies, which could finally regulate our status and recognize at least our basic rights as human beings, if no more than that. So in that sense, we will still speak up, and we will continue to do so. I know that we are not a big organization, and our goal was not to expand so much. We were trying to focus on a very specific issue concerning social and uh, political problems, and but I can see that now we are being more and more approached by other movements, organization within the Basque country and Spain in general, in order to share our experiences, because we all live within the same reality. And in that way, we can make our voices be heard, and it's the only way to have our human rights respected. So thank you for giving us this space also to share our experiences, to share how we feel, and I'm open for all the questions and commentaries.
floor to Nurhidayah Hassan. She will present a new White Plus study assessing European Union funds to migrant women's associations before and in the context of COVID-19. See, can you hear me? Because it says that my connection is weak. Is it okay? Yeah, okay.
Yes,
Sorry.
I can hear you.
Okay, thank you.
Thanks.
So I continue the presentation and then I give you the floor. So Hidayah, she will present this study, and she concludes that the very necessary work of migrant women's groups and associations to promote gender equality and women's human rights is often overlooked. Next to writing this study for White Plus in collaboration with the White Plus Gender and Migration Working Group, Hassan is completing her second Master in International Development from the University of Grenoble, France, after a career doing research, teaching and working for civil society in Singapore. Thank you very much for here. The floor is yours. Sorry.
Okay. Thank you, Virginia. Now, good morning, good afternoon, and good evening to everyone here. And I'm happy and extremely honored to be in the presence of an incredible group of activists and feminists doing very important work in advancing and protecting the rights of migrant women and girls. And I thank all the panelists for bringing this crucial and sobering insights on the experiences of migrant women, girls, and children during COVID-19. As Virginia has mentioned, I am Nurhidayah Hassan. Most people call me Hidayah, and I'm currently an intern for White Plus. I come from Singapore, a very small island city-state in Southeast Asia. So in my studies, I have a very keen interest in gender and development issues. And now, as part of White Plus, I'm also happy to be able to present an important study that we are currently undertaking. Now, not only does this study have significance in terms of its findings, this research is also crucial in supporting all the important work that our panelists are involved in advocating for the rights of migrant women in the European Union and its neighboring countries, especially in the context of the pandemic. Now, in this study, we are reviewing existing literature on financial support to migrant women's associations. And in my presentation, I would like to briefly introduce the key conclusions from this study and our plans for launching the paper. Now, before going into the conclusions, I would just quickly touch on the topic of COVID-19 and migrant women. As all the panelists before me have presented, they've given many examples of how the pandemic and lockdown measures have impacted migrant women and girls in different contexts and different countries. Now, to give further examples, in France, where I am, domestic violence cases increased by a third just a week after lockdown took place. Domestic abuse service organizations in the UK call for emergency protections for migrant women in the wake of the pandemic. Now, even before the pandemic, migrant women have been exposed to heightened risks of femicide across Europe. As we know, they occupy more vulnerable positions, being economically and legally dependent on their male partners, and migrant women struggle with multiple barriers to justice and social protection. Now, with all these issues, we have seen how migrant women groups, such as the ones that our panelists belong to across Europe, have managed to provide support, collective action. They've acted very swiftly, provided safe spaces for different migrant communities before and during the pandemic. So more needs to be done to support their work. And many migrant women are very actively contributing to their communities, their workplaces, and their families. And they function as solidarity networks, filling in gaps where governments are failing. And now, with governments slowly lifting lockdown measures and planning recovery funds to stimulate their economies, migrant women and their rights continue to be ignored. So in our study, we review not only existing financial mechanisms, but also the proposed measures in the upcoming EU Recovery and Resilience Fund. Now, a recent gender impact assessment done by economists Dr. Elizabeth Klatzer and Dr. Azura Rinaldi for the European political group, the Greens and the European Free Alliance, this study concludes that the EU Recovery and Resilience Fund, which is meant to help EU member states cope with the economic impact of COVID-19, this recovery fund is completely gender blind. Now, we do not know yet what will be accepted from these packages, and it seems likely that the whole package will be approved. Now, the financial aid from this stimulus package goes mostly into male-dominated sectors like the construction, transport, and agriculture sectors. We saw that during the pandemic, the sectors that are hit the hardest are the health, social work, and education sectors. Now, these are the sectors where many migrant women are involved in, where they provide lowly paid or unpaid labor. Now, the lack of investment going into these sectors signals less effective economic planning, because investing in care and services not only provides more jobs for women, but also provide the same amount of jobs for men. Now, a gender-blind COVID recovery will contribute to leaving more women behind in terms of access to paid work. It risks putting the clock back on gender equalities achieved in paid labor, and we know there are already existing huge gaps in the labor market. Now, across Europe, no government has announced robust measures to help migrant women workers who have now found themselves jobless and without income because of the pandemic. And within our network, within White Plus itself, one common thread our members in Europe have reported on is the loss of income for women, in particular migrant women. Now, if recovery measures are gender blind, gender inequalities will likely to increase again, leaving migrant women behind. Now, given this very important context, White Plus is launching this study, which is the result of an EU-level fund tracking exercise carried out by our network. White Plus made this review even before COVID happened, because the issue of funding for women's organizations, particularly for migrant women associations, is a recurring topic within the network. Now, here, migrant women associations refer to migrant women-led groups that provide support for other migrant women in various areas. And the issue of lack of funding is even more acute with the current realities of COVID-19. Now, why are we interested in these financial flows? As we all know, money is a political instrument that can promote fair and equitable societies, or be used to hinder this transformation. Now, is the public money spent on helping large transnational companies like banks, or is it spent on aiding the most marginalized in our societies? Whose needs are being prioritized and under what conditions? So this question forms the very basis of our study, and it has even greater relevance as we look at the investment priorities of EU institutions coming out of this pandemic. Now, overall, there is available EU-level funding to advance gender equality, but the financial flows simply do not reach civil society organizations enough. The flows do not reach women's organizations much, and they certainly do not seem to reach migrant women associations at all. Now, a starting point in trying to even understand the financial flows of the EU is to look at its multi-annual financial framework and the budget lines that come from this framework. Now, the Multi-Annual Financial Framework, or the MFF, is an instrument of financial planning, and it allocates resources into different policy areas and priorities of the EU for a period of 7 years. Now, under these policy areas, there are various funding streams that are relevant for gender equality, like the European Structural and Investment Funds. But due to fragmented gender-related data, it is very hard to provide in-depth analysis into each funding stream and how they're relevant to gender equality and to migrant women. So what this paper does is it takes an overall approach, an overall look at the existing research done on different EU-level funds and how they impact gender equality and migrant women. Now, I will just quickly go into the main findings of the paper. Now, the first one is that there is a lack of funding going to civil society organizations, and migrant women associations fall into this category. A report by the European Court of Auditors found that only 1.7% of EU budget allocation goes to NGOs, and most of these funds are used for external action. Now, similarly, a report commissioned by the Women's Funds Europe also confirms that EU funds are mostly disbursed to large entities like government agencies and do not reach women's organizations. Now, with the shrinking of civil space and the rollback on women's rights, CSOs need the financial support to continue all the important work that they do to support women and to support migrant women. Now, the second finding that we've found is that despite EU's existing strategy for gender equality, a report by the European Institute for Gender Equality, EGA, showed that less than 1% of the European structural and investment funds, which is one of the key funds to translate EU's policies into action, goes to gender equality. Now, similarly, another report found that only 0.6% of the multi-annual financial framework commitments is dedicated for gender equality action. This is a very, very low amount. Now, the final takeaway is that there is a weak policy focus on migrant women. This is, of course, a big concern because, as we've seen, migrant women face multiple layers of discrimination, making them one of the most vulnerable communities in EU societies. Most of the EU policy action for migrant women are focused on labor integration, very economic oriented, and do not address many other difficulties that migrant women face. Now, moving forward, supported by all these key findings and taking into the consideration that of the new normal that our post-pandemic world is facing, White Plus argues that there needs to be greater gender mainstreaming into EU policymaking and budgets, especially for the EU Recovery and Resilience Fund and the upcoming multi-annual financial framework. Now, these budgets cannot afford to be gender blind, given the negative impacts the pandemic has on the care economy, on women, and especially on migrant women and girls. Now, all these findings may not be news and may not be surprising to our panelists and to the audience, but what we can now argue is that these findings are backed by numerous evidence-based research, and we do note there are important gaps in this research to make the conclusions even more robust. While there is indeed very strong political rhetoric and high-level commitment to gender equality, now, this willingness does not translate to budget allocations or money for women groups and migrant women associations. Now, so what we plan to do is to launch a campaign in a few weeks on the 22nd of July, highlighting the key message from this paper, which is that more money needs to go to migrant women associations. Now, we will be disseminating a campaign toolkit, which includes the study itself, a statement, which we invite organizations to co-sign, a press release for the media, and social media messages so that we can amplify these conclusions on different platforms. Now, we invite you to look out for this campaign kit in your mailboxes or on our social media, or you can contact us, contact White Plus, and we really hope that you can be part of this campaign. And with that, I conclude my presentation. Thank you.
Thank you very much. Well, we have some common points in 4 presentations. We have seen that the vulnerability that migrant women already had before the pandemic are worse now after the pandemic. The poverty situation, the double and triple isolation, the fear and emotional risk, the lack of access to medical care, the gender and institutional violence, the gender blind funds and lack of funding of women associations make the situation worse now. Now we would like to give you the floor to make questions, to make comments, to contribute to the discussion in whatever aspect you want. You can send a message to the chat asking for the floor, and I will give you the floor. Not everybody at the same time, please. Okay, we have our panelists little by little connecting their cameras so we have one comment, comment and question. You all have talked about discrimination and anger and hate. Which is your strategy to work on this contest? So this, I guess, this is the question is from Greta Frankenfeld, and any one of you can take the floor to answer. This, I guess, this is for any of the panelists. So, Tatiana, I see that you, yeah, okay.
Sí,
Yes.
bueno, sí, efectivamente.
Yes, well, exactly. The network, the work of the network is directed into empowerment on the level of community, but also on the political level. What does that mean? Well, specifically in a specific moment when we as migrant women come to the new country, as Silvia explained before, we are faced with a very specific situation which we need to resolve. But we are women with many capabilities, with a lot of strength. We have also behind us a life experience which can help us to overcome circumstance, different structures, laws. So if they all place us in one place where we don't want to stay, that is where our network really does real work in uh, denouncing and in making evident that state, in publicly speaking of it. What does that mean? That, for example, uh, we can participate in political panels. We have done so this year, for example. We participated and made our contributions regarding the topic of prostitution. Then afterwards about structural violence, feminism, all of these topics and all of our work, which is directed towards wider public, is what really gives us empowerment, and that is where we claim our rights, rights which are at some in some form already integrated in constitution, but are maybe not equally applied to everyone. So for us, that's one of the aspects, and another one is work within the network, the way of working together, coming to joint conclusions, coming to joint consensus. For us is and means and translates into reaching a level which shows that we are capable of monitoring, of amending, of receiving the rights which are guaranteed to us. So in Spain, we're speaking that we need to create an agenda for migrant women, which needs to be more publicly obvious and presented. So the help and the organizations are the help provided by institution is just to point out the vulnerability, but we and our work, it's for giving empowerment. So that's the difference. That's what we want. We want empowerment, not simple social assistance as such. Now, I'm not saying that just migrant women suffer from discrimination, because in Spanish state that there are other groups which are being discriminated. And another thing which we said is to creating a different narrative when facing hatred. That's another thing we need to do. So we are not probably responsible to point that out to the public, but we are responsible to trying to change the narrative. So the intercultural dialogue is not just about speaking of differences between countries, different food, different geography. No, it's about central topics like what is my life as a citizen? What is my life as a working professional, not just as a migrant woman, but different kind of women employed in different areas. So um, I try to encourage women to also be engaged in work on a community level, on municipality level, so they can really make that connection and relation not just with other migrant women, but also with other groups such as feminists and women who want to participate in community work. So that is what we do. That is how we change the narrative, because effectively it's really the reality is that not all funds reach all beneficiaries, and for us it's important to work in these topics and in these areas and to work on a more wide level, to be active on many different level and stages. So trying to simply give value to our contributions, because another important element is our children, our sons and daughters. So Silvia came recently. I came 20 years ago. So my daughter is Spanish. She has to carry that burden of being Spanish national with immigrant parents. That different struggle of identity is very difficult. I mean, I know that this is a never-ending story, and but I would like to hear from other colleagues as well, and not to hog the floor. So, yeah, I am going to say something in a little bit about in line with what my colleague mentioned, especially when it comes to um, the political discussion. So that is where we need to participate. So it's not just about complaining, it's about facing the issues. So we need to, before the elections, for example, now, we need to make those politicians listen to us and put our issues in their political agenda. And that is how we change public policies. So we are not going to just sit, complain, and pray for the public policy to change, for them to recognize us. For example, here in Basque Country, it's already a quite widely multicultural community. But on the other hand, we are not on the governmental agenda. We are occupying a great percentage of home workers. That is something that's very impressive. But on the other hand, our issues are not being prioritized in local policies. So that is how we, by actively participate, is how we change things. So present our programs and try to put the agenda in their agenda, so that that can be afterwards, after being adopted, expressed on a social level and the level of the community.
No. Okay. So there is another comment. Thank you for the presentations. If you want to add something else. With Tatiana and Silvia responses, we can see something that I forgot to say after all the presentation, which is the resilience capacity and the strengthening of the networks for self-support that we have seen during this crisis. Every crisis is an opportunity, and I think this dramatic situation has been an opportunity for all these networks, associations, and organizations to strengthen, to strengthen the links among each other, and to build real strategies that are stronger and give hope for the future, for a better future for migrant women. There is another comment, Greta Frankelfeld. Gracias por vuestra respuesta. Thank you for your response. Y a favor de trabajar en red siempre, and in favor of working in network always. If you wanna add something, now it's the moment. Either the speakers or the people participating. And if not, well, I'm going to give the floor to Gea Meyers, just in case she wants to say something, because she is the person who made possible this webinar. So thank you, Gea, and you have the floor now.
Thank you so much, Virginia, and thank you all to all the wonderful presentations by the speakers. I would like to say that we will also make available the recording of this webinar and also work it out in articles. And as Daya told you all, we will have a publication coming soon, so this will also be part of our ongoing work. It's really, I think, one of the what several speakers have said, it's really impossible to make visible the agency and stories, experiences from migrant women, which we take in White Plus, migrant women workers, but also refugees. So it's really a broad definition that we use in our working group. So really, I would like to invite you all to, we will send you this information, and I would like to invite you all to also read it and be in touch. And really a big thank you to all the speakers, which is very rich and wonderful presentations, and from all the work that you're doing. Thank you so much.
Thank you, Gea. Thank you, all the speakers and all the spectators. I don't know the name in English, I'm sorry. The people watching the webinar, assisting and participating in the webinar. Thank you very much. It has been really interesting. I have learned a lot. I think we all have learned a lot, and very inspiring also for the future, for the work for the future. So we keep in contact and we keep working for a better world for everybody, especially for migrant women. Thank you very much and have a nice afternoon.
Gracias, Gea, Virginia. Y a todas, un placer.
Gracias, igual.
Thank you, Tia. Thank you, Virginia. Thanks, everybody.
Thank you.
Vanessa from Congo is saying, hola, hello, thanks, very interesting. Silvina Monteros in Granada, Spain.
Thank you.
Okay.
Yeah.